We found these reports, I don't know if they're correct and whether you could actually clarify this, that a lot of British Asian doctors, that Indian doctors or Asian doctors generally in England have been a higher proportion of deaths. Is this proportion higher than the norm for all doctors, and is there any particular reason why more British Asian doctors are dying than other doctors?
Yes, so the first 10 deaths in the UK, the first 10 doctor deaths were all from black and Asian minority backgrounds, and all of them except one has come from overseas. And this is particularly tragic and sad because these are doctors who have come to the UK, they've given their lives to the National Health Service, they've saved others' lives, and in the process they now have unfortunately died. We also have a far higher proportion of ethnic minority patients who are hospitalized in the UK. About 33% of intensive care beds are occupied by patients from ethnic minority backgrounds. Twice as many Asians are in hospital in intensive care beds compared to white patients. And we occupy only about 13% of the population, so disproportionate effect on Asian and ethnic minority population and also doctors.
Why? That is a bit of a worry. Why is this happening? Is it a worry for all Asians in general? Should we in India be worried that we're a little more prone to it? Or is that an exaggeration and you can't really extrapolate from what's happening in England to here?
Well, it is certainly a worry. These statistics are concerning. Because it's a new virus, it's a novel virus, no one can actually say we quite understand why, but we are looking at it, and I've called upon the UK government to urgently investigate and take action to mitigate the impact on our Asian and black population. Now, one of the reasons that has been put forward is that many of our Asian populations do suffer with what we call comorbidity, higher levels of hypertension, higher levels of coronary heart disease and diabetes, which added together places a person at much higher risk of the infection having a more serious effect. What we're looking at now is whether we should stratify ethnic minority doctors and protect them from front-facing care of patients with COVID. That's what's being looked at. That's one possible reason. Another factor that is of concern is that in terms of our key workers, so we have a lockdown in the UK like you have in India, but hundreds of thousands of people still have to work to keep shops open. We still have our transport still functioning, so bus drivers, train drivers, care homes, and of course healthcare workers. Now those key workers are mixing with others. They can't be at home, so they're probably more exposed to the virus. And as I said, a larger proportion of our key workers are from ethnic minority backgrounds. And that may play a part as to why the infection is affecting ethnic minority population greater. There's a third factor, which is in the UK's overcrowding. The proportion of our ethnic minority population who are in overcrowded houses is far greater than the white population. And as you know, we live in extended families with multi-generational households, so you can have younger members of the house going out to work, doing essential work, coming home and spreading infection in the same household, especially the older population in the household who may be vulnerable with lots of other medical conditions. Another reason why we think, there's another reason why we think this is happening is also because of the lack of public health messaging being understood by some of our ethnic minority communities.